you've just had a bit of a look at a simulation activity. So the debriefing. Okay, well really the simulation is terrific, but it's really the debriefing where things get unpicked and where the learning happens. Okay, so who should debrief? Who's had students? Yep. And any conversation that you have with a student after they've performed an activity is pretty much a debriefing. Yep. So really, everybody should debrief. You know, if you're a manager, you debrief your staff, you talk through. It's a conversation. When should it happen? Well, it can happen ideally immediately after the simulation. The way that our setup is that our simulation rooms and our debriefing rooms are adjacent, so we can come straight out of the simulation and into the debrief without any interruptions. That works well for us because if people are sort of wandering off down the corridor, they tend to escape off to the toilets, or they're checking their phones, that sort of thing. So it's important for us to try and get people straight into the debrief straight afterwards. Things are fresh in your mind and you can really start to unpick it. Why is it important? Because it's where the learning happens. How do we do it? We're going to be going through that over the next half hour, part of the journey. And when am I an expert debriefer? I'm still waiting. Thinking on the 12th of never, maybe. Because it's like any other skill. The more you do it, the more practice you have, the better you're going to get at doing it. And it really is part of the journey. The more insights you have into yourself and the baggage that you bring and the frames that you bring, the better you're going to be at debriefing and helping somebody else on that journey. So there's a nice little definition that's come from the Centre for Medical Simulation. So these are the Bostonian gurus. But they emphasise that debriefing, a good debrief, should be a conversation. So it's someone asking and someone offering information, and it's a two-way street. I'm going to bring you back to the basic assumption that we have on our walls here, and that's that everybody who is taking part in the activities is intelligent, capable, they care about what they're doing and getting better at it, and that whole wants to improve. Any of the health settings, I'm sure, have the quality improvement cycle. It's that, but it's more personalised. So there's different approaches to debriefing, and the judgmental approach is a nice little label for something where I'm telling you what you did wrong. How conducive is that to really having somebody open up? Might be good if somebody's done something really dangerous and you actually need to have the conversation straight afterwards of, you know, when I saw this, you were actually putting your patient at risk, so you're needing to intervene as quickly as possible. But really, you need to get away from the basic assumption that somebody's actually wanting to do their best and is wanting to improve. So it's not a particularly great approach, but we need to touch on it anyway. Non-judgmental, much nicer. You know what you're thinking, but you're not actually saying it overtly to the person who's debriefing. So you gently lead them to your frame of mind. Much more touchy-feely, much longer process, and many more steps to achieve what you're looking for. So, you know, you've got in mind exactly what you want them to get out of it, and gently through a few steps, you're taking them there. So it does take time. You can see a few faces sort of going, oh, I'm not sure about. Now, I work in a pretty busy workplace. That sort of stuff's going to be something that I might take as a last resort. Okay, something called plusdelta. So you might be observing a student conducting a session, and you might be jotting down some points, things that they do well and things that you can see that could be improved on. So this is a pretty easy way of doing things. It works well if you've got limited time for your debriefing session. It works well when you're starting out learning how to debrief. And it's kind of nice to have that one if there's a specific event that you're talking about. And it's very good if you're getting peer feedback. Do any of you use peer feedback with your students, where you get peers to evaluate them? Some people do. Yeah. My background was speech pathology, and we will quite often get speech pathology students on a placement that we'd put into pairs, so they get quite used to debriefing each other. Plusdelta tended to be the approach that those novice debriefers would use, where they're writing down, you did that really, really well. And generally it was pretty much a 3-to-1 ratio. They'd like to tell each other the things that they did well, and there was only a couple of points that they would talk about where things weren't done as well, which probably is about right, especially when you're learning. Yeah. And it's so easy for a student to lose their confidence. Yeah. And debriefing with good judgment. So this is an approach that's taught by the team from the Harvard Medical School, where you're coming in basing your debriefing on the basic assumption that people want to improve, that everyone's here because they want to learn, and that, you know, people aren't stupid. Yeah. What you're trying to do as part of this debriefing with good judgment is take yourself into the other person's perspective and see what they're doing through their eyes. So in that burn scenario, where Aleka, as the doctor, was basically not acknowledging the contribution of the paramedics. Yep. What I might do in that is to say, Aleka, what I noticed in that scenario was that you looked very focused on what you were doing. What I didn't see was you really engaging and interacting with the paramedical team. Can you talk to me about what was going through your head at that period? So it's an open-ended question. It encourages her to reflect on what she was thinking and to tell me about it, so that I get a better understanding of the reasons behind why she appeared to be very, very focused on the task there, but was completely blowing off the people in the corner. Does that make sense? Yeah. Okay. So there's a little model that goes with that, and it talks about frames. So the frames are the thoughts and opinions that we all bring to a situation. So you might be aware that there are certain populations that are more confrontational for you. Certainly for me, I prefer not to work with an autistic client. I find them quite confronting. So I actually have to be aware of that before I go into a situation, and that's just knowing your strengths and weaknesses. It means that you tend to see a situation and expect that what you're seeing fits into the way that you're thinking. So you might have a student come to you and say, oh, Lee, this girl is so difficult. She is just a really difficult person, a really difficult student. She's been failed by 2 or 3 different supervisors. Now that's going to frame how I see that student, and quite significantly. And it's one of the reasons that the university particularly doesn't give information to supervisors about how a student's gone in a previous activity, so that we're not colouring your judgment. So you have your frames, and they come back to your assumptions, your emotions, your goals, your rules, and your situational awareness, and it's also influenced by context. So it might be a very, very busy situation that's going to change things for you. The actions, what actually takes place during the simulation scenario, and what the goals are. So where are we wanting to get people to, and where are the gaps in their existing abilities and their existing knowledge. And that comes to the results. So the debriefing takes people from their results back to their actions, get them to think about it and whether or not they could improve on something, and hopefully we'll also change their frames. Because we've all got gaps and we all want to get better. Okay, so the way that we go about it, They're Americans, they'll give it a name. So they call it the advocacy inquiry method. So the advocacy is you're wanting to see things from the perspective of the person that's being debriefed. You need to be very clear about what you saw and why it matters. So I might say, Julie, what I saw in that last scenario was when you went to get the medications, you went off and got the medications and then you administered the medications without checking that the dosage was correct. I wonder if you can talk to me about what was going on for you at that point in time and how that was going to impact on the patient. Yeah. So it's I saw, I think, explain to me what was going on. What are your thoughts about this? Does that sit okay, or is it a little bit too touchy-feely?
It's good.
It definitely gets people to open up, in my experience. Because we're not judging them, we're just curious about what went on, what happened for them. Okay. So again, there's a nice structured model that goes with it. People would come out of a debriefing, out into a debriefing. The first thing we're going to want to do is let people blow off steam. Now, you've been in a scenario, you've seen those really intense scenarios. Generally, the people are quite charged with adrenaline. You saw the telescoping and the changing of timing. So people come out of it and it's, oh man, that was amazing, or oh wow, I did such and such in that. So you really need to just get to the emotions before you can do any learning. People just need to get that off their chest. So the first thing I'd do in a debriefing situation is just say, how was that for you? And they'll tell you. Yeah. So it's emotion before cognition is a good way of remembering it. You can talk to them about, okay, it was great, thanks for taking part. Now, are we all on the same page? What was your perception of what it was that we were trying to do in that case? And it's quite interesting that sometimes people will come from completely different perspectives. Then you need to get into the debriefing and start picking things apart. So certainly when you were learning about writing scenarios, that thing where you start with the end in mind, you start with your key points. So bring your debrief back to those key points. Was that achieved? So if your key point was to look at communication in a scenario, bring your debriefing back to that. As you get more confident and better with your debriefing skills, you quite often find that you're going off in completely different directions than the ones that you were expecting when you jotted down some notes. And it's following the lead of the person who's being debriefed. Go through each issue using that advocacy inquiry method. AI, artificial intelligence, I think not. Advocacy inquiry. I saw, I think, I wonder, can you explain that to me a bit better? And then we discuss. Well, this is what I'm thinking. Tell me what you're thinking. And then how can we get better at what we're doing? So that is the bulk of the debriefing, is going through those points. And I'm sure Sarah would have touched on the fact that generally the scenario is quite the shortest part of the whole thing. It's maybe a 3-to-1 ratio, so you might do a 5-minute scenario and a 15-minute debrief, and you'd be surprised at the richness of the material that comes out of it. Yeah. What I'd say is it's a great thing as you're learning to debrief to keep those points at the back of your head and watch someone who's a bit more experienced with the debriefing. Sit there and go, oh, I see what you're doing. It's a really good learning tool. So you've got your reactions, your debrief, and then the takeaway. Yeah. So you're summing up the session. So what we've done is we've touched on this and this. So you can then go around the room or the circle, tell me what you're taking away from today's session. And each person contributes. Okay, so sometimes that you want to look at using some other methods. Disciplinary action. Plenty of nurses in the room, and The nurses board can be a fearful thing, I'm sure. Something like coroner's court. You'd be wanting to make sure that all the facts are very, very clear, everything's documented. Criminal or unprofessional activity, I'm sure that doesn't apply to anyone in the room, and hopefully you'll not come up against it in your professional life. If someone is just not engaged and the basic assumption's been thrown out the window, so they don't want to improve, they don't really care about what they're doing, then that advocacy inquiry method of trying to get a better understanding isn't necessarily your best bet. You might need to go in armed with specific examples of behaviour and try something like the when you, I, and I'd like. So when you continually arrive late at work for a shift, I feel like you're not taking your job seriously, and I'd like you to change that behaviour by trying to be here 100% of the time, or if that's not possible, giving plenty of notice. So if, yep. Time poor, plusdelta is always a good one for time poor. You did that well, that wasn't so great. Maybe we can talk about that in a little bit of detail and then wrap that up and move on. And if there's safety issues, so if you've got a student that's about to do something that's just horrific, or a colleague that's about to do something that's going to result in a sentinel event, yep, that goes out the window and you go straight in. Okay? Alrighty, so some debriefing aids. So that's just a nice simple plusdelta form that we use here. It's always good to have some cheat sheets and maybe make some templates up. There's probably quite a few sitting on the internet these days. The one on the right is the plusdelta one that we use here. The one on the left basically talks about skills and learning objectives, identify roles, what's your shared mental model, etc. So, some general tips for debriefing as we come to the end of the afternoon. Be human, be honest. People can tell if you're assuming a role. Be interested. Be really caring about what it is that you're trying to get to the bottom of. You're inquisitive. They're helping you understand them better. Good debriefing does take trust on both sides, so no one's going to open up to you if they think that you're just going to, get them to open up and then come down on them. You need to pitch things at an appropriate level. So we're all on a journey. Sometimes something 3 months' time is going to be a lot more advanced. Keep the discussions on track, because sometimes you do get people that will dominate the debrief if there's multiple people in the room, or who'll want to go off on a completely different tangent, so sometimes it just needs to gently be brought back to the aim of the session. Validate people's emotions. Sometimes some of the scenarios will bring up events in people's lives that are really quite powerful, and they might be feeling quite distressed and they need to get that out. Explain to them that, it's a simulation, but you can get upset because it does bring back we are all human. Normalise that. Enjoy the work and put in the effort. So, I think the best debriefers are passionate about what they're doing, they're passionate about what they're teaching, and it's not really work and effort for them. But I'd say 100% of the really good debriefers would say they're still honing their skills and getting better at what they do. So I encourage you to go back to your workplaces and watch the people who've got a bit more experience, watch what they do and think to yourself, that's a good one, I'm going to use that. We will do it. Okay. Assessing the debriefer, it's a good idea to regularly review other people's work. Have a look at yourself, have a look at your colleagues, have a look at your learners. And that brings us to the end of that little one. So any queries, questions? Okay, I guess we need to revisit the parking lot as we come to the end of the day. So, Rochelle, did we cover all your queries? Well, how about that? That's great. All right, so what we'll do is closing comments. All right, let me just say it's been a pleasure having you all come along today. We always enjoy having people come to the centre, and we really love being able to share the passion for simulation that exists here with everybody else. Please don't be strangers. We're here as a resource and to help you. So you've got email addresses, you've got contact details. Use them, use each other. We'll be trying to hook you up as an email group so that you can be in touch with each other. So I encourage you to bounce ideas off each other and to take part in the wider world of simulation. Just this afternoon there's an email come through talking about a simulation networking event, so I'll make sure I send that out to you as well. So it just helps people get their networks in order. But yeah, don't be strangers. I'm sure that everyone here is just more than happy to help as much as they can. Evaluations. So I think, Sarah, we've made them user-friendly, so mostly it's tick boxes because everyone thinks at the end of the day, great, they want 3-page script, so write as much or as little as you like, but we have tried to make that easy for you. And we have a certificate of participation for you all for coming along today.